Today we're gonna talking about toxoplasmosis. Do you know what is toxoplasmosis? Toxoplasmosis isn't just some cat disease. It's a microscopic parasite called Toxoplasma gondii, and it's one of nature's creepiest hijackers. Here's the scary part. Once it enters your body, it can hide for decades inside your brain and muscles. Reprogram your cells to spread faster. Cross the placenta in pregnant women within 48 hours, putting your baby at risk of blindness or brain damage. Scientists just found strains in Brazil that are 10 times more aggressive than what we knew before. And guess what? They're spreading globally through imported meat. Even if you've had toxo before, new guidelines warn, immunity isn't guaranteed anymore. New mutant strains mean you could get reinfected. Classic symptoms include mild fever and fatigue. But toxoplasmosis is the ultimate trickster. New researchers found it's evolved to hide in plain sight. Here's what you're not being told. Number 1. The anxiety trigger. Johns Hopkins study just linked chronic anxiety to low-grade toxo infections. If you felt off since pregnancy started, this could be why. Number 2. The vision thief. New Brazilian strains attack retinas silently. By the time you notice blurry vision, damage may be permanent. Number 3. The hormone hijacker. Toxo mimics thyroid hormones. Because toxoplasma is structural similar to thyroid hormones, it can lead to immune system attack to thyroid hormones. And this can be cause of sudden weight gain or hair loss. Please get tested. It's not just pregnancy. If you have headaches and light sensitivity, brain inflammation is probable. And muscle twitches, with high possibility shows neurological involvement. Forget cats. New research proves pre-washed salad kits are now the first infection source in the USA. But why? These triple-wash greens contain biofilm pockets where toxo thrives. New study flash in Journal of Food Protection found 22% of store-bought salads tested positive. In last months, the WHO quietly added Toxoplasma gondii or BR2 to their watch list. This new strain contains 1. Resists all standard meds. Pyrimethamine is useless in 40% of cases. 2. Spreads via mosquitoes in tropical zones. 3. Attacks sperm. Yes, men can now pass it to partners. Everything you knew about prevention is obsolete. Here's the updated protocol. First, freezing meat? Useless. BR2 survives minus 20 degrees Celsius for weeks. Second, gloves? You need full face shields when gardening. It's now airborne in damp soil. Third, only a test works. Request CRISPR toxo blood panels. You know what proved the most disturbing new finding? Toxo rewires your brain to crave risky foods. Yale studies show infected people are 3 times more likely to eat undercooked meat. Comment cravings below if you suddenly wanted rare steak. If you're thinking this can't be real, I've linked the studies in description. Most doctors will tell you, once you have toxo antibodies, you're immune. But new research from Johns Hopkins reveals a terrifying truth. There are 7 strains of Toxoplasma. Antibodies for one don't protect against others. Reinfection can happen via organ transplants or blood donations, even with antibodies. Demand a strain-specific test if you're high risk. Toxoplasmosis isn't just a mom problem. Here's why everyone should care. According to new findings, this disease can be cause of bipolar disorder in teens. Men with toxo have lower testosterone and higher aggression. Seniors face 3 times higher dementia risk if infected. Outdated medical textbooks say get rid of your cat, but new science says this is dead wrong. Keep your cat. Just change the litter daily because parasites need more than 24 hours to become infectious. Strictly avoid consumption of these real dangers. 1. Rare steak. New research shows that cooking meat at 74 degrees Celsius kills parasites. 2. Unpasteurized cheese. Local cheese may be delicious, but 30% of Toxoplasmosis cases are transmitted this way. According to new studies, Artemisia annua is a useful shrub that can block parasite entry to cells, but most obstetrician gynecologists don't know. Forget just avoiding sushi. New studies say you must change in your kitchen. According to FDA new update, meat frozen at -12 degrees Celsius for 3 days kills Toxoplasma. Okay, here is veggie wash formula to clean your surfaces and clothes. 1 teaspoon baking soda and 1 cup water together removes 92% of parasites. Pasteurized cheese is safe, but watch out for fresh goat cheese, because it's a silent carrier. Use clumping litter. It's 50% less likely to harbor parasites. Keep your cat indoors during rainy seasons. Parasite eggs spread faster in damp soil. You love gardening? These 2025 hacks save you. Nitrile gloves block parasites better than latex. Solarize soil by covering with black plastic for 72 hours in summer kills eggs naturally. You want traveling to Europe or South America? New risk zones you'd never guess. First country is France. Avoid consume raw milk cheese. 30% of cases linked to Brie camembert. And second country is Brazil. Avoid fresh acai bowls because local water contamination risk. Now you know how to avoid it. But what if you're already infected? Okay, stay calm, but time is critical. Here's exactly how to get tested in 2025. Here are diagnostic updates. Demand a PCR test. Standard antibody tests miss 20% of early infections. Insist on blood PCR. Results come in 48 hours. Home test kits. New FDA-approved, at-home finger prick tests now have 90% accuracy. Fetal monitoring. If you're pregnant, request weekly ultrasounds to check for hydrocephalus or placental thickening. Your diet should contain low arginine foods. Avoid nuts and chocolate. This diet starved the parasite per 2024 Johns Hopkins research. Supplements. Based on study, in 2023, vitamin E and selenium cut cyst formation by 40%. Disinfection. Steam clean surfaces at 70 degrees. Toxoplasma cysts survive bleach but die at high heat. Even after treatment, stay vigilant. Here are critical checkpoints. First month, repeat PCR to confirm parasite clearance. 6th month, eye exam. Retinal scars can appear months later. Pregnancy planning. Wait 3 months post-treatment before conceiving, according to new specialists' guidelines. If you remember one thing from this video, early treatment saves lives. If this video saved you hours of research or gave you peace of mind, do me a huge favor. Smash that like button so YouTube shows this to more parents. And hit subscribe if you believe science-backed pregnancy advice should be free. Share this with someone who needs it. And remember, this information isn't in most doctors' offices yet. And stay curious.